Now, an effort to slow the opioid epidemic. Last year, we told you the state legislature opened the door to create what are called safe injection spaces where people can use drugs while being supervised. We've learned that is now on hold. Callan Gray explains why.
Nasal Narcan.
At Southside Harm Reduction Services, Jack Martin
It's really helpful to have.
make sure people have clean needles, xylazine test kits, and Narcan.
We work to reduce overdose deaths and prevent the transmission of HIV and other infections related to drug use and living outside. It impacts every community.
And when he learned last year the Minnesota State Legislature passed a law providing millions of dollars to the Department of Human Services to create grants to establish safe recovery sites.
I was, and all of us at Southside were incredibly excited.
Under the law, those sites could include needle exchanges, drug testing, and safe injection spaces where people use drugs while being monitored by a medical professional.
These sites really often end up operating like hubs that draw people in who otherwise might not be getting any care at all.
But now, DHS says safe recovery sites will not initially include those safe injection spaces. Writing online, quote, federal law has been interpreted as prohibiting safer use spaces. While this state legislation was a huge step forward, Minnesota and its harm reduction partners have a lot of work to do before the safer use aspect of the safe recovery sites can be implemented. Going on to say, however, the agency is committed to making them a reality in Minnesota because they, quote, have been found to be highly effective in saving lives.
It prevents people from using in public spaces. It prevents people from using alone. And it also works to bridge people to other services such as healthcare, housing.
Martin tells us he supports the state taking its time and in the months ahead hopes to see outreach to the community that will use these spaces.
We really support safe injection sites. However, we also think that it's really important to roll them out right.
DHS says it's going to be doing community engagement and putting out a request for proposals in the coming months. That first round, though, will not include safer use spaces. They say after the initial contracts are in place, it will do further community outreach to look at how to add in that component. Southside Harm Reduction Services tells us they are interested in operating one of these safe recovery sites. So a lot still ahead.
And we all want to see lives saved.
Mm-hmm.
Thank you, Callan.